bed capacity.
Mulago National Referral Hospital is stepping up preparations to introduce highly specialized liver transplant surgeries, expanding its advanced care services beyond renal transplants that began in 2023. Hospital management says the demand for such life-saving procedures among Ugandans is significant and long overdue.
Earlier in the year, I mentioned that we are going to start liver transplant. We also already have partners. The theaters we use are exactly the same because for renal transplant, because we designed the theaters for organ transplant. So we are doing renal, we are going to do liver transplant. And the teams are scheduled to go for skills enhancement. They already have the skills, but we now are trying to brush up. One team will go to India for a month in January, and the second team, when the other one comes back, another team goes in February. Then we start putting together patient preparation. In another 2 months, maybe March, April, they will have screened the patients, and then June, we should be able to carry out the maiden liver transplant.
The hospital's roadmap does not stop at liver transplants. Plans are also underway to introduce bone marrow transplant services, critical in the treatment of blood cancers and severe blood disorders such as sickle cell disease. Uganda records more than 20,000 children born with sickle cell disease every year. Without timely diagnosis and specialized care, many do not live to celebrate their 5th birthday, an urgent public health concern experts say requires sustained investment.
Because there's high need. I know that some of those hematology diseases would do well following bone marrow transplant, but we are taking one bit at a time.
Dr. Byanyima says Mulago has registered notable progress in strengthening key support services, including pathology, laboratory medicine, and radiology, with new diagnostic and treatment services introduced in recent weeks. These improvements, she notes, are essential in supporting complex procedures such as organ and bone marrow transplants.
Although understaffed, we hope to recruit more pathologists so that we reduce on the lead time for some of the results that come out of pathology. Recently, we did a super major surgery laparoscopically, and that was radical prostatectomy using pinhole surgery, and this is a big milestone. In a paying hospital, one would pay not less than 40 million for such a procedure.
However, the hospital warns that these ambitions could stall without adequate government financing and staffing. Mulago is currently facing a budget shortfall of 104.7 billion shillings, particularly for essential medicines and supplies, posing a serious risk to service delivery.
The staffing level currently stands at 57%. So if we are operating at 57%, if the pass mark is 50, we are just above the pass mark. And that affects the quality of service in some areas. There's where we cannot compromise. If you are going to carry out a number of operations, probably if you would have done 4, you end up doing 2 because the same teams cannot work efficiently on the 4 of them. So and that creates a backload. And when we have a backload, then the public thinks, oh, these people need to be bribed money, in order that my patient is on the list for surgery. We are doing so much with so little. Our budget for essential medicines and sundries, which we get from national medical stores, currently is 8.6 billion. What would be optimal would be about 35 billion. For the medicine for the patients, The budget we have is about 23 billion. We need about 101 billion. So that's the budget shortfall. It reduces our outputs, and sometimes we have to ask the attendants to take care of some of the items that we cannot provide.
The hospital leadership has also issued a caution to the public, urging responsible behavior to reduce preventable emergencies and ease pressure on the already strained health system during the festive season. Mulago's planned expansion into advanced transplant care marks a major milestone for Uganda's public health system, but hospital officials say sustained funding, human resources, and policy support will determine how far and how fast these services become accessible to patients who need them most. Walter Mwesigye, NTV.